If you're over 50 and that stubborn itch has been bothering you and doesn't seem to want to go away, it's important to pay attention because in the next few minutes, I'm going to show you how a simple itch in 3 specific areas of your body can be a warning sign for health conditions that, if undetected, can silently worsen. Pay close attention because what I'm about to reveal can be crucial. Our body is wise, and knowing how to interpret its signals is fundamental for a long and healthy life. Experienced doctors are observing with concern the increase in late diagnoses, precisely when early detection could change everything. The information I bring today is valuable and can make a big difference to your health and well-being or that of someone you care about. Hello, and a very warm welcome. Today, our focus is on an extremely important, often overlooked subject: how an apparently harmless itch can be the first sign of a more serious health condition. I'm not talking about a fleeting itch, but very specific symptoms located in 3 key areas of the body, which modern medicine already identifies as warning signs we shouldn't ignore. Before we detail these 3 areas, I want you to understand why an itch isn't always just a superficial nuisance. Our skin, the body's largest organ, acts as a window to our internal health. Studies published in renowned journals like The Lancet show that there are complex pathways connecting our skin to internal organs. When something isn't right inside, the skin is often the first to signal it. Dr. Ana Maria Gomez, a specialized dermatologist, explains that a persistent itch in certain areas should always be investigated, as it can represent the external manifestation of a significant internal imbalance. This information is corroborated by a study from the Journal of the American Academy of Dermatology, which followed over 2,500 patients with chronic pruritus and found that 23% of them were later diagnosed with a serious medical condition. Let's start with the first critical area: the palms of your hands. Did you know that a persistent itch on your palms, especially with redness, can be a warning for liver problems? This is because when the liver isn't functioning well, substances that should be filtered accumulate in the blood, causing skin manifestations like itching. A study in the World Journal of Hepatology showed that about 70% of patients with primary biliary cirrhosis reported intense itching on their palms as one of the first symptoms, long before other signs appeared. The second area that deserves our attention is the elbows. A persistent itch on the elbows, especially if accompanied by small blisters or reddish rashes, can indicate dermatitis herpetiformis. What many don't know is that this skin condition is directly linked to celiac disease, a serious autoimmune disease triggered by gluten. Research in the New England Journal of Medicine reveals that approximately 85% of patients with dermatitis herpetiformis also have celiac disease, even without clear gastrointestinal symptoms. This means that an itch on the elbows can, in some cases, be the only sign of a condition that, if untreated, can lead to nutritional deficiencies, osteoporosis, and even increase the risk of certain types of cancer. Dr. Carlos Eduardo Ferreira, a gastroenterologist, states that this skin manifestation is often mistaken for eczema, delaying the correct diagnosis for years. If this content is being helpful, please like and subscribe for more information that can, indeed, be decisive for your health. The third critical area is the anal region. A persistent itch in this area, not related to obvious causes like hygiene or hemorrhoids, can be an early sign of uncontrolled diabetes. A study in the journal Diabetes Care followed over 1,000 newly diagnosed type 2 diabetes patients and found that about 32% of them reported anal itching as one of their first symptoms months before the official diagnosis. This happens because high blood glucose levels favor the growth of fungi such as Candida albicans. What makes this symptom particularly important is that many people feel embarrassed to mention it to their doctor, delaying the diagnosis of a condition that, if not controlled, can lead to serious complications like neuropathy, retinopathy, cardiovascular diseases, and even amputations. Now think for a moment, how many people do you know who might be going through this without any idea of what it could mean?
If this content is valuable to you, share it with those you care about. A simple share can make all the difference. But when is the right time to see a doctor? How can you differentiate a common itch from a warning sign for something more serious? This is a common question, and I'll clarify it. First, persistence is a key factor. An itch that lasts for more than 2 weeks and doesn't respond to common treatments should raise an alarm. According to the British Journal of Dermatology, chronic itching, which persists for more than 6 weeks, is associated with an underlying medical condition in about 50% of cases. The second factor is intensity. Itching linked to internal diseases tends to be stronger, often described as so uncomfortable that it disturbs sleep. In the case of itching on the palms related to liver diseases, many report that the sensation worsens at night, a phenomenon known as nocturnal pruritus. The third factor is the absence of visible skin rashes. When we talk about pruritus associated with systemic diseases, the skin can often appear normal, which confuses patients and doctors. As Dr. Ana Maria Gomez explains, itching without visible lesions, pruritus sine materia, should be investigated carefully as it is often linked to metabolic, endocrine, or neoplastic disorders. And now, if you've identified any of these signs, what tests might your doctor request? For suspected liver problems, tests like AST, ALT, GGT, alkaline phosphatase, and bilirubin are fundamental. Studies show that changes in these markers can be present even in early stages. In the case of dermatitis herpetiformis associated with celiac disease, in addition to a physical examination, a skin biopsy for direct immunofluorescence can confirm the diagnosis, revealing IgA deposits. Additionally, serological tests for specific celiac disease antibodies, such as anti-tissue transglutaminase and anti-endomysial antibodies, are essential. As for anal itching associated with diabetes, diagnosis begins with tests like fasting blood glucose and glycated hemoglobin, HbA1c. A recent study in diabetes research and clinical practice showed that patients with unexplained anal itching had significantly higher glycated hemoglobin levels even with only slightly altered fasting blood glucose.
I want to pause to thank everyone who is still with us. If this content has been helpful, please leave your like and share it. You can't imagine how many messages we receive from people who identified serious conditions early thanks to these alerts. After all this knowledge, I want to present something that can transform your health. I've developed a guide called The Youth Code, where I explain in detail a 30-day plan with foods, supplements, and habits that promote longevity and full health. It's material that goes far beyond what we can cover here. To learn more, just click the link in the description or in the pinned comment. Now, let's delve a little deeper and talk about other subtle symptoms that can accompany these itches, and that, when combined, increase the chance that we're dealing with a serious condition. In the case of itching on the palms related to liver diseases, watch out for signs like yellowish discoloration of the skin or eyes, jaundice, even if subtle, dark urine, or lighter-colored stools. A study in the Journal of Hepatology revealed that 63% of patients with chronic liver diseases ignored palm itching for months before seeking help, only seeking attention when more severe symptoms appeared, a delay that can be critical. For dermatitis herpetiformis on the elbows, other warning signs include unexplained fatigue, joint pain, and anemia that doesn't improve with iron supplementation. Harvard researchers found that patients with undiagnosed celiac disease have a 4 times higher risk of early osteoporosis, as intestinal inflammation prevents the proper absorption of calcium and vitamin D. Imagine how many fractures could be avoided with a diagnosis based on something as simple as noticing an itch on the elbows. As for anal itching associated with diabetes, other signs include constant thirst, frequent urination, especially at night, occasional blurred vision, and slow healing of wounds. According to the International Diabetes Federation, about 50% of people with type 2 diabetes already have complications at the time of diagnosis, because early signs were ignored for years. A rarely discussed but very relevant aspect is the impact of these diseases on our gut microbiota.
Recent research in the journal Nature shows that changes in the gut microbiome not only precede the development of metabolic diseases like diabetes, but can also directly influence skin manifestations, such as chronic pruritus. It's a fascinating field that connects our gut health, immunity, and skin health. Now, let's debunk some common myths about itching. First myth: all itching is just a skin problem. As we've seen, this can be dangerously misleading. The skin reflects internal imbalances. Second myth: if there's no visible rash, the itch isn't serious. In fact, pruritus cyanometeria, itching without visible lesions, is often associated with more severe systemic conditions. Third myth: antihistamines always solve the problem. For itches associated with systemic diseases, common antihistamines, at best, offer temporary relief without treating the cause.
What impresses me most is how simple changes in dietary habits can profoundly impact these conditions. In the case of celiac disease, eliminating gluten not only relieves the itch, but also reverses intestinal inflammation. For patients with itching due to liver diseases, reducing processed foods and alcohol can decrease the toxic load on the liver, alleviating symptoms. And for diabetics, a balanced diet with a low glycemic index controls blood sugar and reduces fungal infections that cause itching. If you're absorbing this information, please leave your comment. Your story can help others in our community. We've reached a crucial point: when to seek medical help. According to the American Academy of Dermatology, consult a professional if the itch persists for more than 2 weeks without an apparent cause, if it interferes with sleep, or if it's located in one of the 3 areas we discussed. We cannot stress enough the importance of early diagnosis. A multi-center European study, published in The Lancet, showed that the average time between the first symptoms and a definitive diagnosis for these conditions is approximately 2.5 years. This delay is linked to poorer prognoses and lower life expectancy. Dr. Paulo Ribeiro, a hepatologist, emphasizes that for chronic liver diseases, each month of early diagnosis can mean additional years of quality life. This is supported by data from the U.S. National Institutes of Health showing up to a 45% reduction in mortality when liver conditions are diagnosed early. It's worth noting that there are risk factors. For liver diseases, history of viral hepatitis, regular alcohol consumption, prolonged use of certain medications. For celiac disease, family history or other autoimmune diseases. And for diabetes, obesity, sedentary lifestyle, and family history. These factors increase the need for vigilance. I'd like to share an inspiring message to conclude. Your body is constantly communicating with you. These seemingly harmless itches are, in fact, messengers, alerting you to internal imbalances that need attention. By learning to listen and interpret these signals, you become the protagonist of your own health. Know that prevention will always be the best path. Regular checkups, a balanced diet, regular physical activity, and stress management are pillars to prevent the conditions we discussed. And remember, shared knowledge is multiplied power. If this content was valuable, don't forget to leave your like, subscribe to the channel, and activate notifications for more information that can transform your health and quality of life. Your comments are very important. Share your experience or ask your questions. For those who want an even deeper dive into prevention and longevity strategies, be sure to check out the Youth Code, where you'll find a complete 30-day plan with all the guidance to optimize your health and vitality. The link is in the description and in the pinned comment. Thank you for dedicating this time to your health. Remember, being attentive to your body's signals isn't paranoia, it's wisdom. Sometimes the difference between health and illness, between life and death, can lie in something as simple as an itch in a specific place. Take care of yourself, observe yourself, and value every signal your body offers. Until the next video, where we'll continue our journey in search of more health, longevity, and quality of life.